All right, hello everyone. We are going to be going over infant CPR, which again is very similar to adult and child. There's just a little bit of difference between how deep you're compressing, what you're using versus your hands and fingers. The videos unfortunately will not play through this PowerPoint because they're on the American Red Cross website, but I will look for videos on YouTube and send them your way as well. This is going to be a super short lecture. Wow, I can't talk today, sorry. But just listen to this, take notes as needed. It's pretty much the same thing as adult and child, just with a couple differences. So the first video that I'm going to send you guys a link to is the cardiac chain of survival. We already went through this. Again, you see someone go down, you check for responsiveness right away. Tap, shout, hey, are you okay? Look, listen, and feel for breathing, ABCs no longer than 10 seconds. If there's no pulse, no respirations, anything like that, call 911, get an AED immediately, and then you automatically start giving CPR. So start with your 30 compressions and then your 2 breaths. And this, again, will increase their likelihood of survival afterwards. So we're going to go through our primary assessment then for child and infant. Again, we want to check for responsiveness. So tapping the shoulder, tapping their chest, doing a sternal rub. For infants, you want to flick the bottom of their heel or kind of like rub the bottom of their foot to see if they're responsive. The infant pulse is also a little different. Instead of doing the carotid artery up at the neck like you would for an adult or a child, you're going to take the brachial artery, which is on their arm. Children actually have a stronger brachial pulse than a carotid pulse, ironically, so that's where we're going to find the best pulse that we can for an infant. Again, if there is no response to the infant, summon more advanced medical personnel, so call 911. If there's anyone around you, tell them to call 911 for you, and then get an AED and start your compressions right away. You want to open the airway, so again, tilting the head back, not as far as we would for an adult or a child. Again, the infant is smaller, we don't want to break them. Check again for their breathing, so this is when you're going to look, listen, and feel no longer than 10 seconds. Again, that pulse is that brachial artery rather than the carotid artery. If there is no breathing, but they have a pulse, you're going to just give ventilations. So that's your breaths. With an infant, it is not like breaths like we would give an adult. It's however much air that we can fit in our cheeks at once, and it's just 2 little puffs. Infants have really, really small lungs, so if we give them normal breaths like we would a child or an adult, we can actually expand them too much and cause further damage. Once we determine if there is breathing, if there is a pulse, obviously we're not going to do CPR. They're going to be fine. Again, if they're not breathing but they have a pulse, just ventilations, and then if there's none of the above, you're going to start CPR. So quickly scan for severe bleeding if there is any, and then provide your care as needed. For infant CPR, we want to use 2 fingers, so these 2 fingers, and again, just below the nipple line, 2 fingers below the nipple line on an infant, but we want them to be perpendicular. So if our nipple line's horizontal, our fingers are going to be perpendicular, so they're going to be vertical with that on the infant. And again, I will send you guys a video of giving infant CPR. So our hand positioning. Again, just a review for an adult and child, one heel of the hand in the center and then the other one overlapping. You want your fingers pulled back off of the chest, so you don't want your fingers or anything touching the adult or the child other than the heel of your hand, so right here. For infant, like I already said, if you're looking for an airway, same thing, the heel of your hand on their forehead, slightly tilt their chin back, and then bend down, look, listen, and feel. For an infant, if we see them choking, we want to finger sweep with our pinky. Adult and child is our pointer finger. When we're giving compressions, adults are about, or at least 2 inches when we're compressing, that depth. Child is about 2 inches, and then infant is about 1.5. Again, infants are smaller, so if we compress any more than that, we're going to cause more damage. The rate you want to compress is 100 compressions per minute. So 100 compressions per minute. The cycle is still 30 chest compressions and 2 ventilations all across all 3. So adult, child, and infant, always 30 compressions, 2 breaths, no matter what, unless you have 2 people with you. If you have 2 people with you, And then for your adult, it's still 30 compressions and 2 breaths. Your child and infant will change to 15 compressions and 2 breaths. Okay, that's it. That's all I have. If you have questions, shoot me an email. I will be holding office hours on Thursdays from 10 to noon through Microsoft Teams. I set up a kind of group for us. I will be calling out probably around 11 for you guys, 10 o'clock for my anatomy class. So I will be on there for an hour. If you guys have any questions, please take a look at this. And again, I will send you those links for CPR for an infant. Stay safe, everyone.